My name is Julie Swann, Julieswann.
And what's your position or title?
I'm Department Head of Industrial and Systems Engineering, and I'm the Allison Distinguished Professor at North Carolina State University.
Okay. And so we are going to talk today about this second wave, potentially, of coronavirus cases amidst reopening. I'm here in Tulsa, Oklahoma, and the last several days we've seen our record high surge of cases. Each day, like nearly doubling. 458 was the number of new cases in Oklahoma yesterday. So we're seeing those cases skyrocketing as we started reopening last month.
Mm-hmm. Can you still see me, or did it went away? Is that right?
It went away, yeah. I'm not seeing you right now.
Okay. Yeah, just 1 second. I just want to I want to pull something up.
Okay.
Just 1 second. I want to look at the graph of that.
Okay, that sounds good. Okay.
Yeah, my computer was supposed to be on, but it flipped out on me this morning, so
oh no,
I don't have it up yet. Yeah,
okay,
it happens,
no worries.
Right?
Yeah.
So, okay, let's see. That looks like it. Because when people talk about, okay, all right, so I've seen what it looks like for you.
Okay.
And one other moment, deaths per capita have, still very low. Okay, all right. So I'm going to go back to the screen with you, but that tells me the current status there.
Okay, great. And so after reviewing our data, what lessons are there to learn, or what should we know?
Well, it does appear that Oklahoma has had a significant increase in cases over the last days and weeks. And a lot of people talk about the second wave. To me, it almost seems like Oklahoma may still be in the first wave, where there is still a big increase to come that is much more significant than what has happened so far.
Which is unfortunate because, everybody was kind of bracing for the worst, and we closed everything down. And I know businesses suffered, families suffered economically because of it. But if I'm hearing you right, things are about to get worse, which to me says potentially businesses could be forced to close again. Is that premature?
Well, so I think that across the nation, what the shelter in place and businesses closing have done is it has given our systems time to prepare. So what we hope is that the hospitals and the public health systems and the doctors, they've procured the necessary equipment that they need, like personal protective equipment. They've made plans for dealing with that surge in demand, including making sure they have enough healthcare personnel and backup personnel if some are out sick. And they've made sure that there are plans in place to increase the bed capacity, if and when that is needed. So I would say that time period when businesses have been closed is certainly not lost. And, this terrible, financial disruption and social disruption during that time has been needed to help make those plans, and not only for hospitals and other system organizations, but also households, making sure that households can get face coverings, that if they want to wear them, they will be able to do that, which helps protect the community as well. It is certainly possible that shelter-in-place orders could be put back in place at some point in the future, both for Oklahoma or other places around the nation. But I know that governors and legislatures are doing everything they can to help protect the public and allow us to move forward in these difficult times.
So if this is still our first wave, what can we expect as far as a second wave? Would that be once kids return to school or students return to college in the fall?
It's a great question. It depends a lot on the behaviors between now and then. So what could happen is if a lot of people wear face coverings and that helps protect others around them and helps reduce the spread of the disease, then that will continue to flatten the peak and we can go about our everyday business and still, get things done in life and work and all of that, while that does spread the pandemic out. And so that wave would be longer, but it wouldn't be as high. And so we wouldn't have the problems that the hospital systems would be overwhelmed. It's still unknown a little bit what's going to happen during the hotter summer months and whether that will decrease virus transmission or not, with a greater number of people being outside. Scientists think that the COVID virus is not going to act exactly like influenza. So I am expecting that it will continue to circulate in the summer. And what we could see is that as some people are doing their holiday traveling, that also leads to greater mixing and allows that virus to continue to circulate. Now, you asked about schools and universities. It is possible that that could lead to an increase in the fall, as well as other things as we start to see influenza circulating in fall and winter, and depending on what that influenza virus looks like. We don't know exactly what this next 6 to 12 months look like. And I would say anything that we can do to help our health systems be prepared, our households to be prepared, while continuing to slow the disease through relatively easy interventions like face coverings.
As an engineering professor, what role have you played in studying this, the spread of it and the impact it's having on our country?
That's a great question. I've been studying pandemics more than 10 years. We started before that and we built computer models of what would happen during a major pandemic. We were then hit with the H1N1 pandemic in 2009 and 10. And so we were able to use our models to help with some of the decision making around food distribution, school openings or closures, and really planning of that health system. I was later on loan to the Centers for Disease Control and Prevention, where I was also looking at some of the logistics and distribution issues around vaccine and making sure that we can get vaccine out to the public quickly and in ways that also, allow opportunities for everyone to get vaccine. And I have continued looking at a variety of different system issues and decisions where there are often trade-offs between multiple objectives. There may be constraints and resource limitations because you never have, infinite money and people to get things done.
Mm-hmm. As an expert, someone who studies pandemics, what would you say about this one, the position that we were in when this one hit our country earlier this year?
Well, I certainly wish that we had been faster in ramping up our testing capacity and really even our preparedness as initial reports started coming out about the pandemic. It's always easier to look back with perfect hindsight, but I do think that there were some gaps that are well known and well discussed in multiple places. I'm more interested now in how we can move forward, and we have a long way to go, and there are still significant risks to the population, both in terms of cases of COVID-19, which can lead to being out of work and lost productivity, as well as deaths, both in the total population and in vulnerable populations. And so, I think that we should continue to focus on what we know can work to reduce the spread of COVID-19, including things like testing and contact tracing, as well as continuing to physically distance ourselves from others and trying to avoid high-risk situations where we might be breathing each other's air.
Julie, it seems like here in Oklahoma, after about 2 months, we all got tired of it. Everybody is tired of not seeing their friends, tired of not traveling. And I'm even observing fewer people wearing face masks at grocery stores. Obviously, President Trump was here this weekend, and maybe 1 in every 300 people at best inside his rally were wearing face masks. What advice do you have to Oklahomans who are totally tired of social distancing and wish we could be normal again?
Don't we all wish that we could be normal right now? My family too. It's a bit like tornadoes and hurricanes to some extent. People, forget, and they are focused more on the short term, and myself included. And it's hard to be prepared and take steps to mitigate and be ready for that tornado or hurricane. And especially if you haven't felt it very directly. And for many of us, we may not have had someone close in our network who has really been strongly affected by COVID-19 or died from it, but it will happen. So it's more a matter of when than if, and really continuing to look at what the science says about it. It is coming. Now, we do need to go about our daily lives, but humans are resilient. We can find ways to do so. I do think that one of the easiest interventions is to wear a face covering. It's not always easy. I have trouble getting my kids to wear them sometimes, but we try to set the example for those around us and try to also frequent places that are using face coverings more, because that is helping to protect community members and help reduce that spread of transmission. But behaviors are really important. So everybody can think about, what am I doing to reduce the spread of this disease?
Mm-hmm. I know you don't have a crystal ball, but do you have any idea how long might we be wearing face masks?
That's a great question. It may be different in different states, depending on risk factors like the density or the connectedness of that state, or where they are in the pandemic so far. Some states have had more cases so far than others have. There are cultures where you see masks on a regular basis, like some cultures in Asia. I personally am prepared to wear a mask for months. In certain types of environments, like when I lecture to students or when I go to a grocery store. And I think, or when I go to a house of worship. And I think that those are things that I can reasonably do to help protect the public. So our best guess is somewhere between 3 to 9 months at this point before we would have a vaccine. And, we hope that we don't have to get to herd immunity before we have a vaccine. And herd immunity would mean that enough of the population had the disease that it can't spread any further. But for that to happen, 60 to 80% of the population would need to be infected. And that is a huge number of deaths. That would make the number of deaths 5 or 10 times where they are right now. So we need to do everything that we can to slow it until there's a vaccine available.
That was great. Julie, is there anything else that you think is important to this story? You've definitely given me everything I need to work with. I think I'm just going to pull the latest numbers, which we should get from the state health department at 11 o'clock tomorrow. So
yeah, there's one other thing that I think would be useful to remind people, and it doesn't have to come from me, but it's that what you do today affects your cases 2 to 3 weeks from now and your hospitalizations and deaths after that. So people shouldn't expect to immediately look and see, well, did the rally this weekend lead to an increase in cases? We won't know for a couple of weeks. And so what you should think more about is, what am I doing today that can make sure that we don't see an increase in cases 2 to 3 weeks from now?
Very smart. That was great. Thank you so much. I really appreciate it.